So the question is the surgery necessary? Well, the obvious answer to that question is, what do you mean by necessary? So the question then is the child developmentally appropriate for a given surgery? And then the question comes down to the child's cognitive skills. This is number one. And what do I mean by cognitive skills? What the heck does that mean? Well, by cognitive skills, I mean the executive functioning in that child. And then you can say, well, wait a minute, what the heck does that mean? And I'd say that I don't have a simple answer, but the answer, and the reason why I like the term executive functions, is because it's the kind of functioning that a CEO has to be good at in order to be a CEO, the chief executive officer of a big corporation. So the important aspects of executive functioning is, does the child understand the basics of what's going to be done? If you take a 5-year-old and you're talking about anti-incontinence surgery, they're not going to understand the surgery. They're not going to understand having to catheterize afterwards. They're not going to understand any of that, except a lot of it will make them afraid. But what they can understand is being wet and being dry. So that's the kind of understanding I'm talking about. So then the other aspect, another aspect of executive functions, is how well can the child plan and then organize based on planning? Well, again, if you're talking about catheterizing a stoma for an augmented bladder in a child who's got bladder exstrophy, they're not going to be able to plan specifically to catheterize and to get prepared for that. They're not going to be able to organize in any meaningful way that you might or the surgeon might want them to organize. But what they can do is plan for the fact that mom and dad are going to get them ready for catheterizing, and mom and dad are going to have a set of skills, but a set of materials, namely the catheter and some lubricant and maybe a little cleansing cloth, to go ahead and proceed with the catheterizing in a confident and competent way. Mind you, at the beginning, no one's competent, so don't expect to be competent and confident at the beginning. You're going to be scared, and that's where the surgeon comes in. So you're going to depend on your surgeon and his nurse or her nurse for a great deal of the training in that, and that's fine. Another aspect is does the child have the developmental level of being able to pay attention to what's going on? So the child has to be attentive enough to let you go ahead and do the catheterizing. It's going to be a fight at the beginning because it's going to, let's say, scare the child. So the child's going to have fear at the beginning of this. So they have to learn, and they have to learn by exposure because there's no other way to do it. They have to learn from being exposed to being catheterized that they can put up with it, that it's not really going to hurt in a serious sort of a way. They are going to have some sensation, especially if the catheter strikes the back of the bladder or the bottom of the bladder from the inside. And that's going to scare them because it's a very bizarre internal sensation that no one is used to. But again, they'll get used to that, and you and the child will get used to how to do the catheterizing without really hitting the bladder any place. The other aspect is does the child have developmentally the social skills required to maintain the ability to be catheterized and ultimately in the long run to learn how to catheterize? And that means all of these things, whether we're talking about planning or organizing or attentiveness, or whether we're planning on talking about social skills, all of these aspects are appropriate based on the age of the child, basically the age. But again, some children are ready much earlier than others. Some children are ready much later than others. Most kids will be ready somewhere in the middle. So you have to figure out with your surgeon and probably with your pediatrician helping, maybe even with other adults or teachers helping to figure out if your child is really developmentally appropriate for a given surgery.